Well, hello. Thank you. Thank you for joining me today. I appreciate your attention and time on this. Today is part 4 of 5 on a knee meniscus series. We are covering anatomy, how it gets injured, what a chronic tear looks like, different therapies you can try at home. Today, we're going to talk about different treatment options: repair, remove, or Regenexx. So listen, I want to just start off with a little bit of housekeeping. I am not diagnosing, I'm not treating, I'm not building a physician relationship with anyone on this YouTube live series. So I just want to kind of set that straight. I'm not making any medical claims, any product claims, anything of that nature. But let's get started on this. So we talked about acute tears, right? Axial load and twist. We see it in all kinds of different sporting injuries. And there's really minimal repair that actually can happen here. As we recall from early on, there is what's called the red zone here, this outer part of the meniscus where there's actually decent blood supply. And in some of the studies I looked at, the repair can happen anywhere from 4 to 20% of the time, because the majority of time the tear is not in this area. But when that can be repaired and re-sewn, that's what they'll try to do. Now, these repairs have about a 20% failure rate, so it's not even really foolproof. Then we move into sort of the chronic tears. These are things that just happen with age, maybe from an old trauma, certainly with just wear and tear, right? Life. And the risk factors we talked about: climbing stairs, kneeling, and don't forget an elevated body mass index. So our weight and all those forces translated across the joint. These respond less well to surgery and very rarely are repaired. They just can't repair it because there is poor blood supply on that inner 2/3 of the meniscus here. So we're not going to likely get a repair out of it because of poor blood supply. So they remove it. But when they remove the meniscus, it adds a lot of pressure into the joint and accelerates the degenerative process. So that's not even really a good solution. And 3 randomized controlled trials published, 2 of them in New England Journal of Medicine, showed that knee meniscus surgery in middle age is no better than fake surgery, sham, or physical therapy. And there's about 850,000 of these done in the United States every year. And I'm guessing the majority of these are done more so in the middle age, more so with these chronic tears, which we're going to find on MRIs, because these chronic tears are like wrinkles on our skin. We all likely have some version of that going on in our body. So not always the best thing. But let's talk about what else you can do at home for these acute tears. Some of that would be stair-stepping the care. I just saw a friend who had an acute tear, and it was definitely red with limited range of motion and swollen. And she was icing, elevating, and using non-steroidal anti-inflammatories. Probably a good approach till things calm down. She was not going to see an orthopedic surgeon because she had surgery on the other side, and it didn't really make that big of a difference for her. We're going to talk about what I recommended to her here in a second. Now, for these more degenerative tears that we see in middle age, probably, 30 on, I know 30 is not middle age, but probably more about 30 years old and up, things you can do at home. So modifying what you need to modify, right? So if you're going to continue to play sports, you might want to wear a hinged knee brace. If you're a little bit overweight, you may want to work on getting that down. We talked about this yesterday in strengthening the quads, the hamstrings, the glutes, the calf, and the core, right? Some of that. We talked about removing pro-inflammatory foods, sugar, seed oils, omega-6 oils, canola oil, sunflower oil, corn oil, etc. We talked about nutritional supplements, glucosamine sulfate and glucosamine HCl, chondroitin sulfate, maybe fish oil, turmeric, resveratrol. Those things can be possibly helpful for these kinds of chronic musculoskeletal meniscus degenerative changes in the knee. We talked about kinesio tape, also very helpful. Braces have been shown to help knee pain and function. orthotics to distribute the weight more appropriately, and even a therapy shoe called APOS, APOS, which you need to work with a therapist about. Now, I would really always recommend a second opinion if you're looking at surgery. First off, remember that chronic tear, the fraying, that's going to remove more of that tissue. And 1 in 5 musculoskeletal diagnoses are incorrect. So a second opinion is really important here. And this is where we're going to look for other things as well: osteochondral defects, ligament laxity, muscle imbalances, etc., kneecap pain, ligament laxity. All these things need to be really evaluated to make sure you're not getting a surgery on the wrong thing and not expecting to get a result out of that. These removals increase the pressure in the removal of the meniscus tissue, increases the pressure in the joint, causing it to degenerate faster. And there's about 800,000 knee replacements done in the United States as well. So is there a correlation? That's a great question. You know, when you undergo surgery, you've got anesthesia, and it can take 6 weeks to, sometimes I've heard, a year to really get that stuff out of your system. It's going to take physical therapy, some extensive amount for some people. It's going to require opioid pain medications, and repairs fail at 20%. Removal fails at 5%, but it leads to a lot of other things, including accelerated degenerative changes. So I would think twice about that. So considering a non-surgical technique. So we talked about remove and repair. Let's talk about Regenexx today. What we do here today is a non-surgical approach using your own cells that come out of your body, your blood platelets and your bone marrow concentrate. And we concentrate these cell types, and under ultrasound, video, X-ray, or ultrasound, which is ultrasound, I'm sure you've heard of that. We place those cells back into the damaged tissue using a needle. So we're leaving you intact. We're not removing anything. These cells have growth factors in them that get the local repair cells, and every tissue has local repair cells. Unless there's just really poor blood supply, like in the meniscus. And so we can get the local repair cells to work harder, longer in that area. If we're using bone marrow concentrate, the bone marrow concentrate can actually really act as a general contractor, calling in other cells to help with the repair job. They can also turn into our brick and mortar, ligament, cartilage, bone, and tendon. So will we see the regrowth of a meniscus? Probably not. Will we see improvement of pain and function? In many cases, yes. And I'm going to talk more about that tomorrow. So the recovery is a lot less because we're using a needle. We're not removing any tissue. We're not putting you to sleep. Pain is less because we're not removing any tissue. And so medication use is less, like opioids in particular. And there's a lot less downtime. Many people who have this done get back to their life literally in days, not weeks or months, where a surgical, whether repair or removal, is going to require months of physical therapy and ongoing care to really get you back to being functional. So I hope this was helpful for you. If this was helpful, please share it with a friend or a loved one who may be looking for other solutions to their knee pain. And I'll be back tomorrow, same time, 11 o'clock Mountain. 11:30 Mountain, 1:30 Eastern. And we're going to talk a little bit more about Regenexx, how we do what we do. We'll talk a little bit about the outcomes and share a non-surgical approach that can address this knee pain and keep you out of the OR, keep you away from the risks of surgery, the downtime, and the rehab. So like this, if it makes sense to you, subscribe to our channel. And thanks for being here. I will see you tomorrow. Have a great day.